Good morning. My name is Jennifer Puentes. I'm a nurse practitioner. I'm going to be assessing you today. How are you doing?
Good.
Good, that's good to hear. What brings you in today?
Oh, just a annual visit.
Annual visit? Okay, wonderful. Any new complaints? Anything new you want to inform me of?
Nope.
No? You're feeling good? No aches, no pains?
Nope.
No recent colds, no recent travel?
No.
Okay, very good. I'm washing my hands. We'll get started. So can you tell me your date of birth, please?
11/26/91.
Perfect. Okay, very good. And can you tell me where you are?
At your house.
Yes, you are. Okay, and your name is?
Amanda
Amanda
Fernandez.
Very good. Alright, so you seem to be oriented, coherent, with fluent speech pattern, clear thought process, argumentation. Your skin is, not pale, not cyanotic. It's congruent with your race. Smooth, warm. Can't see your nails. You're nice and warm. Okay. No lesions on her nails. Nails are nice and smooth. Okay. No birthmarks anywhere, and I can tell. No cyanosis. The angle of her nail was at least less than 180 degrees. And her cap refill is less than 3 seconds. Very good. And everything looks clean. Beautiful. Alright, so your hair and scalp, very good, nice and clean. Normal distribution, no patchiness, no alopecia, no scaliness, no dandruff, no foreign bodies. Head is normal cephalic, no lumps, no deformities, no trauma. Very good. Face is symmetric, normal facial expression. No involuntary muscles noted. I'm going to go ahead and just check your trigeminal nerve. Close your eyes. Tell me, do you feel that? Mm-hmm. Do you feel that? Mm-hmm. Very good. Open your eyes. Clench your teeth. Good. Move your jaw side to side. Very good. Okay. Can you tell me, close your eyes again? Tell me if you feel this. Mm-hmm. Tell me if you feel this. Mm-hmm. Very good. Alrighty. So now I would check also your corneal reflex. I would grab a cotton ball and I would look for any involuntary blinking. Any absence of that involuntary blinking would be damage to the cranial nerve 5. Now I'm going to ask you to, you already squeezed your eyes shut for me, so I know your cranial nerve 7 is intact. Can you raise your eyebrows, wrinkle your forehead, puff your cheeks? Perfect. Very good. I'm going to palpate your sinuses. Tell me if you feel any pain when I press on them. Pain? Pain? Very good. Okay, eyes. Your eyebrows are no lesions, no styes, no abnormal drainage. Hair distribution is proper, nothing's falling out. No discharge. Sclera is white. Conjunctiva is white as well. It's not pink. No jaundice, no nodules noted. No corneal opacities. I'm going to go ahead and grab the ophthalmoscope right now as well. Okay, very good. So I'm going to check your pupil. Perfect. I see a consensual reflex and a direct reflex as well. Very good. The iris is brown, no shadows noted. Pupils are round, symmetric, reactive to light. Consent, like I mentioned already about the consensual and direct reflex. Alright, convergence. If you can please just follow my finger without moving your head, okay? So I'm going to bring my finger. Very good. Perfect. Okay. I was just texting your cranial nerves 3, 4, and 6. And I did not notice any nystagmus or any lags. Now I'm going to ask you to look at me and cover one eye. Perfect. And let me see tell me how many fingers you see when how many fingers you see?
3.
Perfect. Cover the other one.
3. 2.
Awesome. Very good. Okay, so now we are going to do your visual acuity test. So I would have a Snellen chart 20 feet away, and I would ask you to read the numbers and letters on the smelling chart and tell me what you see or don't see by covering first your right eye, then covering your left eye. From there, you can determine if there's any problems with your visual acuity. Okay. The normal would be 20-20, which means that at 20 feet you see what people normally see at 20 feet. Okay. So moving on, now I'm going to just look at the interior of your eye with the ophthalmoscope, if that's okay. I see the red eye reflex, beautiful. Alright, I see a macula, pinpoint. Very good. No extra hemorrhages, no extra exudates, masses. No physiological cup noted with no papillary edema. And go ahead and do the same to the other eye. Red eye reflex perfect. Alright, same, no papillary edema, macula intact. No hemorrhages, no exudates, no extra arteries or nicking noted. Okay, so now I'm going to also examine your ears. So her ear is symmetric, size and shape, no lesions and deformities noted. Any pain?
No.
Perfect. I'm going to go ahead and examine your left ear first. Okay. Alright. Cone of light present, eardrum nice and pink. No redness noted, no drainage, no foreign bodies. Ear canal is nice and clear. And bony landmarks were present. I'm going to go ahead and examine now your perfect. Bony landmarks noted, eardrum nice and pearly gray. No drainage, no foreign bodies. No pain when I tugged on the ear. Perfect. Okay, so now we're going to examine your auditory skills. Skills. Okay, so if you can please put your finger over your right ear. Perfect. Tell me if you can hear on the right side. Perfect. Do the same to the left. And tell me if you can hear on the left side. Perfect. Okay, so now we're going to do the lever. Tell me if you hear it equally on both sides, that vibration. Perfect. Still? No changes? Okay. So now I'm going to check your bone and air conduction and see if there's any differences. So I'm going to first bang this against my hand. I'm going to put this up against your mastoid, and then when the ringing stops, let me know. So I'm going to put it in front of your ear, okay? Excuse me. Stop. Okay. Stop. Alright, so the other side. Stop. Okay. Okay. So you have no sensory, and what is hurt? No sensory deficits, and your ear conduction is longer than your bone protection, which is what it should be. So perfect. So your nose, I'm going to go ahead and look at it, make sure there's no, it's symmetric, no deformities, no tenderness, right? You're currently not having any congestion or anything to that matter. I'm going to go ahead and just take a peek at it. Very good. I see the turbinus, no bleeding, no septum is not deviated, no polyps, no exudates. Septum is in midline. Nasal mucosa is nice and pink. No inflammation or perforations. Perfect. Okay, and I could see her turbinates were nice and normal shape and size. Alright, now I'm going to assess your cranial nerve 1. If you can please close your eyes and smell this and tell me if you can identify what it is.
Coffee.
Perfect. Okay, so now we're going to examine your mouth. So I'm going to go ahead and look at your lips. They're pink, moist, no cyanosis, no lumps, no crackling. Can you please open your mouth for me? Thank you. Oral mucosa is pink, no ulcers, no nodules, no white patches. Gums are nice and pink. Perfect, no ulcerations. Teeth are white, no fillings, loose or missing teeth. The roof of your mouth was nice and pink, no ulcers as well. And your tonsils are fit within the fossa, no exudate noted. Can you please say ah?
Ah.
Okay, so that's your cranial nerve 9 working properly as you lifted when you said that. Can you stick out your tongue for me, please? Move it from side to side. Alright, that's your cranial nerve 12 working properly. Your tongue was pink, no lesions noted, and smooth. Can you swallow for me, please? Perfect, that's cranial nerve 10. And I would now test your gag reflex with a tongue blade. That will be also checking your cranial nerves 9 and 10 as well. Okay, can you please open your mouth, lift your tongue up? Perfect, I would be looking at your salivary ducts. Saliva is clear, thin, and colorless. So everything looks good there. I'm going to go ahead and assess your neck. Looking at your trachea, that it's midline, no deviation, in line with your suprasternal notch, no tenderness. I'm going to go ahead and palpate for your thyroid. Please swallow. Perfect, no goiter, no nodules. I'm going to go ahead and auscultate for any bruits. No bruise present. At this time, I'll go ahead and palpate your carotid artery as well. There's a brisk upstroke. No bruise present when I auscultated before. Now assess your cranial nerve 11. Can you please press against my hand? Perfect. On the other side as well. Perfect. Can you also push your shoulders up against me? Beautiful. Cranial nerve 11 intact. Moving on to your lymph nodes. I'm palpating your preauricular, postauricular, occipital, submental, submandibular, tonsillar, anterior cervical, posterior cervical, supraclavicular, and epitrochlear. Perfect. Okay, so now I'm going to go ahead and assess your chest. Looking at your chest first, no lesions present, asymmetry noted, no asymmetry noted. Your respirations are nice and even, non-labored, no distress noted. Your anterior posterior diameter is 1 to 2. I'm going to go ahead and palpate. Any tenderness? Say 99.
99. 99.
Perfect. And I'm going to auscultate. If you can please breathe in and out through your mouth. Breathing in and out through your mouth. No adventitious breath sounds noted. I'm going to go ahead and assess your posterior. No lesions noted. Chest is symmetrical. Spine is non-tender in midline, the scoliosis or kyphosis noted. Can you say 99?
99. 99.
Perfect. Perfect. No adventitious breast sounds good as well. Can you please lay down for me so I can assess your anterior chest? I'm going to palpate with the palm of my hand, assessing for any thrills. No thrills present at the point of maximum impulse, which is the fifth intercostal, the midclavicular line. I also don't see any heaves. The point when I palpated is not greater than 2.5 centimeters. Anything greater than that would be abnormal. Now I'm going to go ahead and auscultate heart sounds. Starting with the aortic, the pulmonic, the tricuspid, and the mitral. All present, S1, S2 is heard, no murmurs at sight. And now I'm going to auscultate. Now I'm going to assess your abdomen. Okay, so I would examine first, assess the skin for no scars, no striae, no rashes, no dilated veins, abdominal contour symmetrical, no distension, no bulging, no visible peristalsis or pulsations noted. I'm going to go ahead and auscultate. Okay. Bowel sounds present in all four quadrants, no bruise auscultated around the aortic or iliac or renal arteries. I'm going to go ahead and percuss. I should hear tympani. I'm going to go ahead and percuss and I should hear tympani on all four quadrants.
Has to be counterclockwise.
Alright, very good. Tympani heard across the whole abdomen. If I would percuss the organs, I would hear dullness. I'm going to go ahead and palpate lightly first. No guarding, no pain, no tenderness, no masses. I'm going to go ahead and do a little deeper now. Again, no tenderness, no masses, no guarding. Okay, so I'm going to go ahead and percuss your spleen. Starting from an area of resonance to an area of tympani to find total space. Okay, very good. When a spleen is within normal limits, I should not be able to palpate it. So take a deep breath. I'm unable to palpate it, meaning you probably have a normal spleen. So now I'm going to go ahead and percuss your liver. You should be going from an area of something with a dullness. full-time residence is a bonus now. And the measurement that I'm on the liver is 6 to 12 centimeters, while those units in the midsternum would be 4 to 8. Now I'm going to go ahead and palpate your liver. And go ahead and take a deep breath for me. Very good. Okay, no tenderness, no masses. Any pain to this corner over here? No. Any pain when I press here? Okay, so that's a negative McBurney's, negative rough seams. Extend your leg for me and lift this leg up. Perfect. Any pain? Alright, so negative psoas sign. I'm going to go ahead and bend your knee. I'm going to rotate your hip internally. Any pain? Alright, beautiful. So negative arbitrator sign. Okay, I'm going to go ahead and examine your lower extremities. Skin tone is congruent with race. No jaundice, no cyanosis, smooth, warm, dry, good skin turgor. No lesions, scars, birthmarks, ulcers, or varicose veins. Hair is symmetrically distributed. I'm going ahead and check for edema, overblown prominences, no edema present. Perfect. Very good. So I'm going to go ahead and check your pulses, starting with your radial. Very good. Not bounding, not thready. Checking your brachial. It's not bounding, not thready. It's nice and equal. Very good. We'll check your femoral. Very good. Nice and even. Popliteal. Very good. +2. Posterior tibialis. Very good. Okay, and the other pulse we could check with you is dorsalis pedis, which would be located on the dorsal side of the foot, pretty much right about here. All the pulses are fine. I'm going to go ahead and check your muscle strength. Would you mind sitting up for me? Can you go ahead and grab my hand, squeeze? Perfect. Go ahead and bend your arm up. Perfect. Push down. Very good. Bend your arm up. Push down. Very good. Okay, do me a favor and just bend your arms up and down. Okay. Very good. Can you push your arms up to the side? Very good. Can you lift up your legs? Very good. Can you lift up? Very good. Okay. Alright, so now I'm going to check your foot. Can you please extend your leg for me? Bend your foot forward. Lift it up. Very good. This is dorsiflexion and plantar flexion. Plantar flexion, dorsiflexion. Very good. I'm going to go ahead and examine your hip. Can you bend your knee up? Any pain? No? The other side? No? Very good. Okay. Now we're going to do internal and external rotation. This is external rotation, very good. Internal rotation, no pain anywhere, very good. Internal rotation, external rotation, very good. Now we're going to go ahead and check your coordination. So if you don't mind sitting up for me, please. We're going to do alternating movements. So if you can please bring your finger to your nose. Very good. Can you bring every finger to the thumb and go back? Very good. Other side. Very good. Can you stand up for me, please? Stand on one foot. Very good. Stand on the other. Very good. Can you walk on your toes? Very good. Okay, just walk back normal. Very good. No wide gaits. No natural walking on toes. Now I'm going to go ahead and perform the wrong birth test. Can you just please close your eyes? And you should be able to maintain your balance, okay? Excessive sway. No loss of balance. So can you please close your eyes and have your palms up? Okay, no pronator drift noted, no drifts. Very good. Can you sit down, please? So I'm going to go ahead and check your sensory status. If you can please pass me your hand. Close your eyes. You feel that? Pass me your other hand. Feel that? I'm going to check if you feel this vibration. Yeah? Other hand. Very good. Okay, I'm going to go ahead and put an item in your hand with your eyes closed, and you tell me if you can identify it. Okay? It's a Q-tip. Very good. On the other hand, same Q-tip. Beautiful. Now I'm going to draw something on your hand, and you tell me if you can identify what I drew, okay? Circle. Perfect. On the other hand. 2 circles. Beautiful. Okay. Now we're going to do our deep tendon reflexes. Can you just please relax your arm? Actually see the thumb or wrist twitch. 1, 2. Very good. 1, 2. Perfect. Okay. I'm going to go ahead and assess the bicep. I should see the bicep twitch or see some kind of contraction. Very good. Go ahead and do a tricep on this one too. Very good. Perfect reflexes, presence, no hyperreflexia noted, no absence either. I'm going to go ahead and check your propellers. Perfect. Perfect. I'm going to go ahead and assess your Achilles tendon now. Move forward a little bit, please. Now I'm going to check your Lipinski reflexes. I'm going to take off your shoe, excuse me. I'm going to take the bottom of your foot, and I would see a flare in the bottom of your toes if it was a positive Lipinski, but no flare present. And I go ahead and do the same on the other. No flare present, so that's negative exam. Very good. Ma'am, you seem to be in perfect health. It's great to hear. Now we'll go and talk more about other things regarding promoting health, okay? Thank you.